Batcher, Executive Director of Prime Centers. This is Prime Time with Bob Doc Talks. And I'm on who's becoming one of my favorite doctors. She's so cool. Dr. Dana Keys-Frizzle. How you doing?
I'm doing well, thank you. How about you, Bob?
Doing awesome. Now, you are actually fitting us in between appointments at JenCare, right?
Yes, we are.
So is this the appointment you dreaded the most, or
No,
well, I guess it depends on how healthy I am, right?
Well, that's part of it. Yeah, no. This is the one I looked forward to the most today. Absolutely, hands
Okay,
down.
cool. I'm not going to tell you what I had for Thanksgiving dinner.
Oh, okay. That's probably a good thing. We'll just keep that on.
But I did take the right pills to counter what I had. Is that okay?
That seems to be the standard course for a lot of patients. Not sure it's what we recommend, but it's what happens. So.
That's right. Yeah, we're all kind of recovering from the Thanksgiving weekend. Is this when the phone calls start at JenCare?
The phone calls do tend to begin to escalate in the days after Thanksgiving. That's quite true.
Okay, let's talk about the Monday after last Thanksgiving. When somebody called for an appointment, what did they get?
They would get, of course, to talk to our care facilitators, our receptionists, who would then schedule them for an appointment to probably come in to see me or one of our other providers.
So, and I've been to the JenCare in Norfolk, and it's really a cool waiting area in that, but you were sitting in a chair waiting next to people.
Right.
So let's fast forward to the week after Thanksgiving, and I'm still kind of feeling stuffed and not real good. I call in for an appointment. What am I going to get? Probably.
Well, we'll probably ask you some questions about how you're feeling. And depending on how many patients are already in the center that day, how urgent your symptoms are, we may ask you to consider having a video visit or a telehealth visit with one of our providers instead of an in-person visit.
Oh. And how does that work, doctor?
So sometimes that scares people because they think, am I really going to see my doctor? So as long as, again, it's not something that's urgent, that absolutely requires an intervention of some sort or a physical exam of some sort, then we would ask, about your access to the internet, if you have a device that can be adequately accessed as well. And if you do, then we can run a test remotely to send you the link and to show patients exactly how this process would work. And if it can work, then we'll schedule you for a video visit.
Okay. And that working, I mean, that's a matter of clicking on something that might turn blue when you do your cursor over it.
That's exactly right. It's as simple as that.
So anybody that's watching this on Facebook, if they can do Facebook, they probably could run their cursor over the blue letters.
Absolutely. If you do have that type of access, any patient should be able to accomplish that.
Okay. So that's the beginning of the process. So I'm scheduled now for a 11:45 appointment with you. What happens then?
So hopefully at 11:45, as long as the day's been going okay for us, might be noon. And if we're really lucky, it might be a little early. Our nurse will actually call to give you a heads up that it's time for your appointment and to make sure that you have internet access and you have a device that's handy to use. And she will then send a link to your phone or device. Usually that comes via text, but it can come as an email as well. And you're prompted to click on that link and then follow the prompts to allow video and audio access. And so that puts you in a virtual room, and you will wait until she signals me to enter the virtual room, and then we'll be in our private virtual room for a visit.
Okay. So, and now, since this isn't a medical appointment, you've got a Sorara with you, which is hence the mask.
Yes. Soraya is with me.
But if I'm having a medical appointment, will you be masked too?
It depends. If we are having that appointment and I'm in the center with other people around me, I will often be masked. Sometimes we work remotely as well to limit the number of people that are in the center at one time. And in those instances, I'm not wearing a mask.
Okay. One of the worst things there's two things I hate to hear from a doctor. One is you're going to feel a little pressure. That always not good. And the other one is step on the scale.
Oh,
So,
yeah.
Normally,
when
I go to a doctor, yeah, they're doing the blood pressure and making me step on the scale and do that kind of stuff. So then when I get in the room with you, you can do, So does that happen?
So that's a really good question. We really want for that to happen as much as possible. So for patients who do happen to have blood pressure cuffs, or are diabetics who have glucometers at home, for people who are willing to admit they have a scale at home, then we
it reads on my side, by the way.
Yeah, see, then there's no control. We have no controls there. But in that setting, we really love that because all that data actually helps us to give you a more effective visit. So we often ask patients to try to get those things done before the visit. But if folks don't have that, that's something that I think JenCare and a lot of healthcare providers are looking at. How can we get these things into patients' hands? These items that will help us measure important things like their vitals.
Yeah, I mean, I went out and got the stuff because I figured it's time for me to monitor. I have learned don't take my blood pressure during the news.
Right, probably a good idea.
But it has made me be a much more aware of why I might be feeling the way I am, because while talking with my doctor, I'm getting hints as to things I should be looking for.
Right.
And doctor, that's something I think, that accessibility to healthcare, if we kind of remove that barrier of I'm intimidated by technology, we actually could probably get better healthcare because we have access to it now.
I agree. And I think, and I certainly understand the intimidation. Technology has just grown just exponentially in the last 20, 30 years. And I think back to when I started in medicine a little over 30 years ago, we barely used a computer for almost anything.
It was the charts.
Yes. And we hand wrote everything from our prescriptions to our notes in the chart. But now, it's an inevitable part of life. So, we've had to accept that. And sometimes my older patients are, saying, I just can't learn this. But it is really an inevitable part of what we do now. So there are ways we try to walk our patients through it as much as we can because it is intimidating. But this part of it is actually fairly simple as long as you have the equipment.
Okay, now that you've said that, and I realize that no TV host or interviewer should throw their guests under the bus, but I'm going to do it. So when JenCare went telehealth, come on now.
Okay.
What was your original thought?
Okay, so complete transparency.
Yeah.
My original thought was, oh no. And it was, oh no, partly because I thought, am I going to mess this up? But then I also worried that it would be, as you mentioned, intimidating for our patients. But then my second thought right after that was, I have to see my patients. And right at that time in March, and then in April, where we just were not able, we were so limited in bringing patients into the center. I thought, okay, this is a great tool. Let's find a way to embrace this and make it happen.
Yeah, and it's really kind of cool because it's showing the technology was there. It was the application. I remember my wife was in the hospital, and she actually was hooked up with a doctor in Chicago who was able to monitor her stuff and communicate with her in a hospital setting. So this technology that we're now saying, yeah, I don't know if I can do it, has been around for a long time.
It has been around for a while. I'm not exactly sure of how long, but I know at least in the last 10 years, this remote access, especially in hospital settings, has been available for specialists who are in short supply, and so this was a way to make those connections. So the technology has been there. That's true.
Yeah, because I got that phone call. I had just gotten out of the shower, had just put my slacks on, getting ready to go to the doctor's office, when they called, and I thought they were going to tell me the doctor was running late because he always does. Sorry. And instead it was, you're going to do your meeting in Zoom. So, and I clicked on the blue letter like I did for a meeting that morning, and it worked extremely well. What is it that you can accomplish though? Well, I'm taking a chance here because I don't know how I look. How can you decide if somebody's gut ache is more than just overeating at Thanksgiving on Zoom?
That is an excellent question. And I say it's an excellent question because it's a really important one. There are certain things that we can assess by seeing you, which is one of the reasons it is sometimes more important to do the actual video visit rather than just a telephone call.
Right.
So I'm looking at things that, I've learned to observe that may signal more distress. Now, a bellyache is actually a really good example because sometimes I really will need to bring a patient in and lay hands on them, to really figure that out. So, if you say, for instance, a patient calls and they're telling me I've got a fever and I've got, some loose stools but they look okay, then I may say, okay, you look calm. Let's scroll down to your belly. They may not want to do that, but let's just look at it and let me have you push on it and see how it feels.
So if I do this.
Yes, exactly.
Okay.
Just like that. And
I wore the vest for a reason. Okay.
And we may ask you to pull the vest up, but we won't, for our show today. But
yeah, how up close and personal can you get on Zoom?
Well, this is another tight question. That's another good question. You can get as up close and personal as you need to, and as makes good sense. So one of the things you just mentioned is with this person with the belly ache, for instance, I may ask them to show me their belly. We may decide that, this might just be a little gastroenteritis, a viral stomach flu, and we can try to manage it for a couple days with the simple conservative things. But if it gets worse, I'm going to bring them in. The other thing about that is I probably would not really want to have a doctor's visit with you on Zoom because Zoom is a less secure platform.
Gotcha.
When we use a platform that we use, it's very secure. And so I may be more willing to ask to look at more sensitive body parts if we really have to, because it's a very secure network or secure application.
So if at the end of this interview you ask me to come see you, I know I'm in trouble?
Well, it just may mean I need more information. That's what I'd say.
I guess because we've heard stories of who's the guy that was on one of the HGTV shows where some nurse notified him that, hey, you may want to check because it looks like you've got something going on with your thyroid. So, there are things that the layperson may not notice, but if you've seen me on this interview and say, you ought to come in. So my point with telehealth is it has also provided access to healthcare to people who may not take the time to get out of their house to come.
Yes,
it was not really just a replacement to the doctor's appointment, but it really gets you more engaged in the full healthcare.
Absolutely. It allows us to just see them in their natural surroundings. As you said, patients who maybe have difficulty with transportation or they live at a great distance. Some of our patients are caring for elderly parents, and it's very difficult to leave their parents. They have to arrange for someone to be available to be with their parents. So I think that it allows us it broadens our ability to reach patients and provide health care.
And I've noticed that several times you've mentioned it's part of a comprehensive healthcare plan. It's not replacing anything.
That's right. That's right. Because your ultimate goal is to get that patient back in the office. But, there are some things that we can address and manage over a video conferencing call. And if we can, that saves, a lot of time on the patient's part. And it's convenient for our patients, and it gives us a little window into their world.
Gotcha. Now, I got to tell you, Prime Plus, we paid top dollar for this set. I brought a picture in from my house because it looked like I was in prison. And I got the lighting is all done just so I kind of look a lot younger, and that I actually do weigh what my scale says. But if I'm getting ready for a doctor's appointment with you, how should I set it up?
So that's also a really good question. I tell patients, I think, I don't worry about their background, what's going on behind them, but it is important for me to be able to see them. So sometimes I'll have patients and they get on and they do a great job connecting, and then I'm looking at their ceiling. So,
or the one I like is this one.
Yes.
That's the one I like.
That's the other view I get, which is great because, I get a chance to look at their heads. But one of the things I tell patients is to practice and have your screen at eye level. So, you might want to get some books and put some books underneath your screen. Like I probably should have done that today with my screen. Get some books, lift the screen up to eye level. If you have a phone, a lot of patients are doing it on their phones, to maybe, get a stand or prop it on something that's at eye level. And I think if you say eye level, that's easier for patients. Knowing where your camera is on your device is the other thing. Like, for instance, I'm wanting to look at you, but I know I have to look at the camera. So
I know, I do that all the time.
So, I think that reminding patients to look in the camera, to make sure that there's good lighting, to avoid having a lot of distractions, so to turn their TVs down or their radios down. If they have pets that, are active, maybe have the pet out the room, or if there are grandchildren around, maybe have those folks removed. Those are some of the most common things to get ready for that visit. Have a piece of paper and a pen so you can take notes. If they have questions, I recommend writing those questions down ahead of time. So some things like that.
We deal with the same audience, the senior audience. How about a caregiver or a spouse? Should they be with somebody if you're not uncomfortable being by yourself? Is that okay?
Absolutely. In fact, we encourage that. It's great to have that second set of ears and that second set of eyes. That person can often act as the videographer. I've had family members holding the camera, or sometimes I want to look at a limb or another body part, and they'll move the camera for me. And I've often asked patients to enlist family members to help them gain access. Some of our patients don't have smartphones, or they may not have internet access that's sufficient to do a video conference. And so I have one patient who went to her daughter's house for each of our visits.
Okay.
Another patient, the daughter came to her house and brought, her equipment. So family, friends, that's wonderful.
Cool. So what have I forgotten? This is your turn to ask me a question. What kinds of questions would you ask me on a Zoom doctor's appointment?
So on a Zoom doctor's appointment, so some of the things I ask patients, I want to see how, I want to assess how they're breathing. This is a big one. And so I can't listen to your lungs through video conferencing just yet, but a way for me to assess how your respiratory status would be to just engage you in a conversation, to ask you a question that's open-ended where you might have to give me a couple sentences.
Okay.
Or, some people like to give you paragraphs when they talk, which is even better. But that you know, if you can complete a sentence without having to stop 3 or 4 times to take a breath, it tells me a lot about your respiratory status. So I ask patients those kinds of things. I ask them things about having their medications ready. So I always ask patients, even though they say, well, you have my medications, I ask them, please bring your medications and sit them in front of you for the visit, just so we can look at them and see if the bottles are empty, you know, that kind of thing. I ask patients what frightens them, or if they're worried about things we might miss in the visit. You know, do they think they need to come in and see me personally because they're worried that we're going to miss something?
Because so much of medical care really is observation, but it's also kind of having a relationship too, right?
Right. And I think that honestly, medicine is part art and part science. The art part is getting to know people, understanding them, you know, understanding where they're coming from, understanding some of the struggles they've had and the victories they've had, and you know, the experiences that they've been through. And it really gives me a nice palette to understand what I'm seeing at any given point in time. So, you know, when you have that relationship, you can notice if there's a change in that person's demeanor, or if the way they're talking about things doesn't make sense, or if they sound confused, and they usually aren't confused. So the relationship part is important as a diagnostic tool, but it's also the fun part of what we do too, because you get to know people and be a part of their lives.
So if I saw you at Harris Teeter and said, it hurts when I do this, you wouldn't mind?
It depends on the day. If I have an interest of total transparency.
But if I see you on Zoom, and it's important that I tell you that it hurts when I do that.
Absolutely.
And then
Absolutely.
You say what?
And then I say, okay, let's try to figure out why.
Oh, really? I thought you said don't do it.
Well, you know, sometimes that's part of the problem. We're always telling patients we want them to move more. So depending on what it is, I may say, so stop doing it, or let's do that a little more, maybe in a different way.
Yeah, my problem is I just overused it at Thanksgiving.
Okay, then you might just have to stop.
You've made me feel so much more comfortable about taking the conversations that I normally have in person and letting it happen over Zoom. Because I also recognize what I heard you say loud and clear several times is if you're not able to accomplish what you want doing it this way, I can come in and see you in person. Absolutely.
I think that's the goal. We don't want to miss an opportunity to take care of patients. And so if this is a platform that we can use to allow that to occur, that's fantastic. And it has helped us in so many ways to convey good information and to obtain good information. But there are just times when we need to see you in person. You need to see us in person. There's an emergency, you need to be assessed emergently. So absolutely.
Well, I have really enjoyed our conversations, the last one that we had about COVID, and then now this one about, I'm looking forward to talking to you again. And you can find these, by the way, on the Prime Plus YouTube channel and catch up on them. I'm really enjoying getting to know you. And, you know, if you notice any trends with me, let me know, okay?
I will. I'm keeping tabs now, so, you know.
Yeah, I'll calibrate my scale between the next time we talk. How's that sound?
Yeah, we'll find a way to try to, you know, to
it's that accountability at home.
That's right.
Doctor, thanks a lot. Our mystery guest, thank you, Ms. Wadler, for being there.
She had to step out, yeah.
Yeah, thanks a lot. Remember,
my pleasure.
Stay safe, but stay connected. Thank you.